as Dr. Williams said, I'm an associate professor of criminal justice and public administration at San Diego State. And my background, I have training as a social worker, and then I did my PhD in criminal justice. So that's kind of the lens that I'm coming at this research from. So for the past couple of years, I have been working with a colleague of mine at SDSU named Sean Flanagan on research related to trying to understand how people experiencing homelessness meet their basic daily needs, and in particular, their needs around hygiene and sanitation. So access to bathrooms, clean water, showers, and things like that. And you'll notice that on my first slide here, which I could actually make into a slideshow too, I just realized. We're also working with colleagues from environmental engineering, and they actually approached us initially about doing this research because they do work on water quality. And some of you who are local to San Diego may be aware that the San Diego River dumps out into the Pacific Ocean. And it does so kind of in a very high volume tourist area, or pre-pandemic high volume tourist area. And water quality has always been a concern along the river. There is can be high rates of E. coli and other kind of infectious diseases carried by water. There are a couple competing explanations for why this might be. One explanation is to blame it on homeless folks who are living along the river and don't have access to bathrooms. So they are potentially engaging in open defecation near the river. And then when it rains a lot, that excrement gets pushed into the water and can make people surfing in the ocean sick and things like that. But another explanation that appears to be more plausible based on our engineering colleagues' research is, you may know that the San Diego River runs alongside and parallel to Interstate 8, as you can see on this map here. And it just so happens that our major sewer infrastructure also runs along that same path. And our sewer pipes are aging and leaking partially into the river and causing some of what, some of the bacterial issues that we see in the water. And so our engineering colleagues, as they were doing this super cool water testing that I can tell you guys more about, wanted to understand kind of the magnitude of homelessness along the San Diego River so that they could calculate out the probability that the bacterial issues they were seeing in the water could be attributed to people living along the river. So Sean and I are both trained as social scientists. We go out and do field-based type research, which is usually in-depth interviewing, participant observation, things like that. So I'll tell you a little bit about what we did over the past couple of years on that study, and then I'll tell you how we've kind of modified our research approach to continue doing this research during the pandemic. So what you see here is a map of places where people experiencing homelessness have been known to stay along the river. And this map is from about a year ago, but you could go onto the San Diego River Park Foundation website and see a more up-to-date version of this at any time. And that's a great reminder for me to mention that the San Diego River Park Foundation has been an awesome partner to us in our research. Their work is, as an environmental agency, they go out and map where trash is along the riverbed, and then they have a huge army of volunteers who go out and clean up the river on a regular basis. One thing that the Park Foundation did not expect to be so heavily involved in is homelessness. But as they're out doing their cleanup work, they often encounter people and they're incredibly respectful. They just kind of let them know, hey, we're here doing cleanups. We're not trying to bother you at all. But when someone has left the area and it's clear that no one has stayed there, they'll clean up anything that has been left behind. And so they have this really cool mobile phone app called Mappler, where volunteers, when they're out hiking a section of the river, they will geolocate where certain issues may be. And so you can see here on the left, they'll mark things as an inactive encampment or encampment trash. They're not trying to publicize where people are staying. They're only kind of marking it after the fact. So that has been really useful for our work because we wanted to just be able to, place flyers about our study and things like that along points in the river where we knew folks were likely to see word of our research. And so the work that we've done so far is to take students out with us to volunteer with the Park Foundation. You can see here our students using the cell phone app. A lot of the volunteers with the Park Foundation are older and not so keen on using mobile phones, so they're super jazzed when young folks want to come out with them and do that work. I narrowed in here on a segment of the river that may be familiar to you, where the IKEA is on Friars Road and the Home Depot and things like that. So this is an area of Mission Valley that also has a library, a public library, and the library is right next to the IKEA, if you can see that on the map. And so a lot of people experiencing homelessness, pre-pandemic anyway, really relied heavily on the library as a space to use the bathroom, fill up your water bottle, charge your cell phone, access the internet. And so that seemed like a natural place for us to try to conduct some interviews. And the staff at the public library were really awesome and let us set up a table outside the library. And we brought our students with us. We trained them in in-depth interviewing and research ethics. And then we went out and did these interviews just kind of outside the public library, which, as you can see, is also right by the river. So folks were kind of coming and going and engaging with us. We set up a table with a whole bunch of goodies that we could hand out and use as a means to kind of start the conversation. So we had bottled water. It was like 90 degrees most of the days we were out there. So folks were really eager to get water from us, toothpaste, shaving cream, hand sanitizer, things like that, toiletries that folks experiencing homelessness really appreciate. So then we did our interviews, and I'll tell you a little bit about who we interviewed and then why this is important. So we engaged with about 84 people. And as you can see, these are some of the demographics. I believe you've already read things like the point in time count for San Diego and things like that. So the demographics of our sample, even though we weren't able to do like rigorous random sampling, we had to kind of take who we could get. It did shake out to be roughly in line with the point in time count. So what do we know about people experiencing unsheltered homelessness? They are more likely to be male. Folks who identify as white tend to be overrepresented in this group relative to other demographics. but you will notice that Black and Latinx people account for about 30% of our sample, and I think it's roughly the same in the point in time count, but I would direct you to kind of, you know, general statistics about who lives in San Diego County. For Black people, it's about 4 to 6%, so we can see that there is way over-representation of some people of color in the unsheltered homeless population. So 4% compared to 19% is a big difference. This group is generally middle age or older. So we had an average age of about 45. And then you can see how folks identified in terms of where they're currently staying. About 80% of the people we spoke with in this study identified as somehow staying outside, out in nature. Folks stay along the riverbed, they can stay in canyons. A few folks we spoke with were staying in cars or emergency shelters. But possibly the best indicator that we kind of did an effective sampling approach for who we wanted to reach is the length of reported homelessness. So as you can see, the folks that we spoke with in this study have been homeless for a really long time, on average close to 10 years. So these are folks who have been staying outside, who have had either a long bout of homelessness or multiple bouts of homelessness in recent years. So why do we care about understanding why people might stay in a riverbed? And why would that matter for trying to address homelessness long term? There is not a whole lot of research out there about people experiencing homelessness who aren't in what we would consider to be conventionally urban settings. Some of you may have been to downtown San Diego, and in particular the East Village segment of downtown. You know that there are a lot, if you've been there, you may know that there are a lot of homelessness service providers in that area, and relatively speaking, a lot of people staying on the streets there. Much of our research about homelessness is based on those sorts of populations and less about people who, as Dr. Williams was saying at the beginning, may want to be in a more isolated setting for one reason or another. So folks may stay along the river because it offers an added layer of protection. It might be cooler, especially in our hot San Diego summers. Avoiding policing, avoiding law enforcement is a big reason why folks may choose to stay away from an urban setting. Those of you who have been in San Diego a while may remember that a couple years ago we had a hepatitis A outbreak, and in dealing with that issue, the County of San Diego was pretty delayed on installing additional bathrooms and hand washing stations, and the City of San Diego was especially forceful in displacing and pushing people outside of the downtown area so that they could clean up the streets. And so a lot of folks through that kind of came to stay along the river to avoid all of that. And I'll mention that since the pandemic, our River Park Foundation contacts have told us that they've seen encampments along the river increase between 300 and 500%. 300 and 500% increase in encampments along the river since the COVID-19 outbreak. And that is in large part because, at least in the City of San Diego, enforcement of homelessness related laws has not slowed down at all. The police are still giving out tickets. They are still conducting arrests of people experiencing homelessness. And this is my area of passion. It's something that I do a lot of research on to hopefully change the criminalization of homelessness. So I'll just leave it there, but just know that I'm happy to talk about that much more. So in the interest of time, I'm just gonna tell you briefly a little bit about what we found. Here are some brief excerpts from some of our interviews. They're basically just telling us kind of what I just said about how folks really want to avoid police contact because it can really make their lives incredibly much harder, either through being asked to move along. The bottom quote, you know, a person told us, I would like to see the cops try and move out in 3 days without a car, just a shopping cart, right? The top quote, a person told us that the police are the only ones who make him feel unsafe, not his peers, things like that. In terms of health, hygiene, and sanitation issues, this was a very interesting study for us to work on. As I mentioned, I'm a social worker and criminologist by training, and I have no experience in asking people where they go to the bathroom. And so my colleague and I thought that we would have more difficulty than we actually did asking people about their bathroom practices. And I could talk much more about that, but I'll just say that folks seem to be pretty willing to share with us. As you can see from this table, we asked people where they most commonly use the bathroom. And of course, this is pre-pandemic, but a good close to 2/3 of people shared with us that they most commonly use the bathrooms at local businesses. So this could be gas stations, coffee shops, public libraries. And we know that many of those businesses have closed or have been closed during the pandemic. So folks, just kind of keep that in mind, that people are being really affected by the shelter-in-place restrictions that we've had. Another important thing to note is that at least some of the time, about 70% of folks mentioned that they engage in open defecation. And so this has some real public health implications, right? If people cannot access bathrooms and they are forced to go to the bathroom outside, that can spread communicable disease. Not to mention kind of what it says about our society if we have a significant number of people unable to access these basic resources, right? So when we asked people about their experiences meeting their basic daily needs, some folks, it was interesting, we asked them questions about how concerned they are on a daily basis about having access to bathrooms and waters. And a couple people told us, you know, we're really not that concerned. But then when they followed up, they said, well, my schedule is built on my ability to access water or my ability to go to the bathroom. So when I wake up every day, I'm making these plans, right? And then the other strong theme that came out in what folks had to tell us, which is not surprising given their reliance on businesses, is that going to the bathroom during the day is much easier than access at night. And then at night, you also have safety issues. So women may feel especially more vulnerable or less likely to walk a long distance to go to a bathroom at night for safety reasons. In the interest of time, what I'm going to do is move over and tell you just very briefly about my other study that's happening right now. Let's try that. Hopefully you can see, can you see that now? Let's see. Are you guys able to see my slides still? Okay, it's not giving me the weird green box that it usually does, but that's okay. So our current project, and this is something that is happening right now in this moment, so I would love your feedback on it, is a kind of similar study of how people are surviving during the pandemic. So Sean and I, as I mentioned, are field-based researchers. We're used to going out and connecting with people in person and doing interviews and having conversations with folks. We can't do that right now, right? Because as you saw, this population is older. They tend to have multiple health issues, as you may have read about in the paper that Dr. Williams shared with you. They're a vulnerable population health-wise as well. And so we are doing an electronic survey to understand where people are, if they are getting information about how to stay safe and healthy during COVID, where they're getting that information, how they are coping and addressing their basic daily needs during this time, given what you saw about how folks rely heavily on local businesses. If they have been approached to stay in an emergency shelter, like the big shelter that we have in the convention center right now, what types of contact they've been having with the police. We know from the excellent reporting that Lisa Halverstadt has done, and just kind of anecdotally, we know that the police have kept up their enforcement activities. So what are people's experience of that and things like that. So we are running a study right now, a survey right now to understand these issues. And our survey has two different versions. So we have a web-based survey. Many of you have probably taken these kind of surveys a gazillion times, you know, through Qualtrics or SurveyMonkey. So if people have web access, internet access, they can take that version of the survey. But for our folks who may be staying out in nature, and particularly in canyons or along the river, they may not have internet access during this time, given that they can't go to the public library. Some things have opened up now, but we may be going back into a more restricted environment soon. So we have a second version of the survey that is text message based. So we're using a program called TextIt that was developed for public health researchers working in African countries to be able to reach people who may have kind of a basic mobile phone but no internet access. And so it's super cool. You can set it up with all your same survey questions, and you just, when the person is ready to start, they text this toll-free number that we had to buy, and then automatically it starts texting them questions, and they'll just text back a response, whatever they want to say, and then it automatically sends them the next question until the end. So it's pretty cool. And this is how it looks in TextIt, so that you can see kind of the flow. You set up a flow where, you know, so this first question, where are you staying right now? And then depending on what they say, we route them to different scenarios where we would ask them more questions. So you can see that we're asking folks, you know, in the place where you're staying right now, are you able to regularly wash your hands for 20 seconds? Since that's one of the major public health messages that we've been getting. Do you have access to masks? Things like that. And then the biggest demand on my time right now, so it's awesome. We just launched this survey this week, and we've already gotten about 50 people who are interested in participating. So the data are pouring in and it's super exciting. I have not had time to look at the data yet though, because of this last point on this slide, which is we want to pay people for participating in this research. And so we're giving, the survey takes 20 to 30 minutes to complete. It's quite a lot of questions. And so we wanted to incentivize people properly for that amount of time and focus. So we're giving $25 gift cards, and figuring out the technology around being able to text people gift cards has been challenging. Target is the only reliable place to be able to text a person a gift card. So if you ever need to do that, go to Target. So I think I will stop there and open it up for questions and conversation. Thank you for having me.